quick announcements before we begin today. We've got a couple of exciting opportunities over the next week, actually, for this committee. First and foremost, let's start on the social side. This afternoon at 4 o'clock, thanks to our partners at Dorf, thank you, Jeff, and thank you to the team at US Bank. We have our third virtual New Faces, New Places, and we have a margarita masterclass. So you're not going to want to miss it. 4 o'clock this afternoon, learning how to make margaritas. It's going to be the perfect thing to do on a hot day, hot, sunny day here in the summer. At 4 o'clock, our partners at Canteen and Food Fight are going to do a great job with this. So please join us at 4 o'clock. We also have another Economic Development Committee meeting a week from today. We're excited to have DWD Administrator, Department of Workforce Development Administrator, Jesus Villa, giving a very timely presentation on the different changes and rules with DWD. So please do join us and let your HR departments know as well. That'll be a very important conversation, not only for economic development, also for the HR teams. We'll be sending that information out later this afternoon. In fact, thanks to email, I just got the title of his presentation. So we'll be sending that out in the next few hours. Those are our announcements. So thank you again for being here for our Economic Development Committee meeting. And I want to introduce, again, Jeremiah Robinson, the President of Information Assets, who's got a great presentation on COVID-19. Welcome, the floor is yours.
Thanks, Jason. Disclaimer, whenever talking about COVID-19 publicly, I am neither a doctor nor a lawyer, and so any advice that I provide will not be legal, is not legal advice nor medical advice. I'm using publicly available data to share some trends that are interesting that you generally don't get on the news at the kind of level that most businesses need to make decisions. And that's basically my life's work, is figuring out how to take situations of very high levels of uncertainty, bring data to the picture in such a way that you can make good decisions in those contexts. So COVID is a great example of a situation with very high levels of uncertainty. I'm going to start by sharing a trick that you can use to make decisions in lots of situations that have very high levels of uncertainty. And this is called the expected value formula. It's actually very simple, although you can make it complicated if you want to include thousands of factors. But I'm surprised how few people have heard of it. So basically, what this formula allows you to do is to estimate all the different percentage odds of the things that could possibly happen, define the financial impacts of those things, and then come up with an expected financial result. And you, of course, need to include uncertainty in that, like risk in that, but it's a really useful way of making decisions when you have to make a lot of assumptions. So here's a really simple example. Let's say your scenario is that you want to offer a new product, right? Let's say you make ice cream and you want to offer a new ice cream flavor. And you could make money on that flavor, or you could lose money on that flavor over the next, let's say, 4 years is your time frame you're primarily concerned about. If you go much longer than that, you kind of want to start to, consider inflation effects and stuff like that. And let's say there's a chance you could lose $100,000. There's a chance you could lose $50,000. You could lose $20,000, or you could make the equivalent amounts of money over the next 48 months. Then basically you take the odds, and you need reasons why you think these odds are right. You take the odds that could happen, right? Let's say there's a 5% odds based on your research that you could lose $100,000 on your next flavor. There's also 5% odds that you could lose $50,000, 10%, 20,000. Here's the different percentage odds that you could make or lose this amount. Then you basically multiply those odds by the financial impact, and you get a number over here that's not especially meaningful. When you sum up that number, you get the expected value. So the expected result of offering your new ice cream flavor is $20,000. So you need to decide if the amount of money it'll take to invest that $20,000 and the possibility that you could theoretically lose a lot of money is worth that risk. Let me come up with another example that's a little bit more applicable to COVID. Let's say that you're a bank. And let me say early on in this presentation, I'm interested in hearing people's questions. I have more data and information than I can possibly share during this presentation. And so what's most important is that we talk about the things that you're interested in talking about. And so feel free to unmute and ask questions, or to ask questions in the chat. I'd be very happy to hear those and to talk about those. So here's a scenario where you're a bank and you're deciding whether to keep all your branches open because business has slowed during COVID, or if you're thinking about closing one. And let's say, you know, here's your potential impacts during the next 12 months. You could lose $40,000, you could lose $20,000, you could lose $10,000, you could lose $5,000, or you could break even, right? You're not going to make money this year. But depending on what you do this year, that may have an effect on what happens next year. So, you know, here are your potential impacts next year. Here's how much you can make per month next year. So basically, you just multiply this first number by 12 months, right? And then you take the second number, how much you could potentially make per month next year, multiply that by 24 months, and then add those two numbers together. And then you take your odds of any of those possibilities happening, right? What are the odds you're going to lose $40,000 a month each month this year, make $5,000 a month each month next year, and for the following year? What are the odds that that could happen? And then you estimate those odds, and then you basically sum up the values when you multiply the odds by the outcome, and here's the expected result, right? So if you keep all your branches open over the next 3 years, you'll make $165,000. You can do the same exact formula. Let's say you close one branch, right? You're less likely to lose money this year because you can keep your best employees, you still have a certain customer base, etc. So let's say there's a chance you could lose money this year, there's a chance you could make money this year, and you know, in the following 24 months, the chances are higher that you're going to make more money because you'll have this extra branch to absorb excess capacity that arrives again after COVID's done. So basically, you do the same thing. You multiply that first number by 12 months, the second number by 24 months, sum these two numbers together, multiply them by the percent chance that each of these events occurs. You get your result and you sum it up. So if you close one branch, your expected value is $127,000. So branches all open, $165,000 is your 3-year expected value. Close one branch, $127,000 is your 3-year expected value. Any questions about this? I can paste this spreadsheet in the chat for anybody who wants a copy of it. All right, so now I'll get into the numbers about COVID as soon as I paste this into the chat. Actually, I'll do that at the end of the presentation. I don't have the folder open. I'm going to share a different program now. So this is Power BI. It's a Microsoft data analytics program that allows you to do data analysis in a variety of ways. It's designed for, you know, developers to develop reports that then anybody can use. They're pretty intuitive to be able to negotiate. There's a bunch of stuff I'm going to talk about, but I'm going to start by talking about outbreaks. And again, please feel, you know, encouraged to ask questions both in the chat and by just unmuting yourself and, you know, and asking your question. I plan on keeping the talk because I do have a lot of information that I could potentially share. Let me pull the chat up here so I can see if people are asking questions. All right, so outbreaks, and let's start by talking about Wisconsin. So I've, since the beginning of COVID, been using an estimate of the number of people who are actively infectious, which basically takes the number of total cases who arrived today and subtracts the number of total cases as of 12 days ago. That's based on the best research I've been able to find, which is a lot of papers, kind of like averaged out that people are infectious for about 12 days. So there's been a lot of talk about the fact that you don't necessarily infect other people for the first few days that you're sick, but once you do start to infect other people, that lasts for, that period where you were infectious lasts on average for about 12 days. It varies a lot between people, but an average is 12 days. That's what I'm using. So we can see the history of cases in Wisconsin based on that number of people who are actively infectious, right? And you can see the different regions of Wisconsin. We're in South Central Wisconsin right here, so you can see our region. And I'll click on Dane County here so you can see our county. And we can see this big spike that we just had, right? So we were kind of trucking along, 10 cases per 10,000 people from a national perspective, and even an international perspective is really good. So Dane County had been just doing amazing for a long time. And then as everybody knows, and the timeline's interesting, right? Because we had the Supreme Court basically invalidate the statewide order around this time, right? So mid-May, which, we didn't change our rules, but that did mean that other places did, and those people were occasionally passing through Dane County. And then we had protests, right, with thousands and thousands of people on the streets around late May, right? And we had this upward trend that started in early May before the Supreme Court made their decision, right? And then they made their decision and it didn't appear to affect the trend very much. And then we had these protests right around here, which also appeared not to affect the trend very much. And then we had some reopening stuff happening that also appeared to not affect the trend very much and even seemed to flatten it out. So all these events appear not to have had much effect on anything. Now, maybe they did, maybe there was something else that was happening that was reducing the number of cases and they actually had an effect, but it offset. I don't see anything there. And then, right, nothing in particular happened, except maybe it got really warm and the numbers completely took off, right? And this is exponential growth. And I'll show you some other examples of outbreaks from other places, but essentially every place that I've seen that's had an outbreak has had exponential growth where things are kind of trucking along, things are going up and down a little bit, and then all of a sudden completely takes off extremely fast. And then usually what happens is the same thing happens on the other end. You might get a plateau for a little while and it comes right back down, or you hit a point and it comes right back down. Every place that I've seen an outbreak has had that pattern, including in Wisconsin. And I'll show you some examples. The big question is how high is the peak, right? And so you can see right here, I don't know if this is going to be a trend or if this is going to be the peak. But, the last 2 days, it does look like, something has changed. And that could be for any number of reasons. I'm really keeping my fingers crossed that this is a shift. But I'm not going to make that prediction. I've seen other peaks that have like little anomalies. For example, I know that we had rain the other day, which closed one of the pop-up testing sites. So maybe that's the reason we had less people test positive because it was raining. But it's possible we turned a corner. So we're approximately 50 people per 10,000 that are sick right now, which from a statewide and a national perspective is not extremely worrying. Milwaukee has been hovering around 50 people for 10,000 the entire time. The thing that's really worrying is that, growth is exponential. And so until we stop having exponential growth, you don't know how high it could possibly get. It could get really bad. Looking at some other counties, the big example that everybody or people who've been following COVID in Wisconsin know about is the big outbreaks in Brown County, right? There was some meatpacking facilities where people were not wearing masks. And I don't know if you've ever been in a meatpacking facility, it's loud. So when you talk to somebody else, you got to yell. And so everybody's yelling at each other all day long in this meatpacking factory. And so, of course, you infect each other. And so they had a major infection. And you can see the same exact pattern we saw with Dane County, exponential growth. They hit approximately 90 people per 10,000, which is pretty high. And, of course, during this period, it was really scary because nobody knew how high it was going to get. And then they hit the point and they went right back down. We look at Milwaukee County, because that's the most populous county in the state, and they had the same experience, about 3 weeks ago, where they had, more than 3 weeks ago, about 6 weeks ago, where they had exponential growth. They hit a peak of about 60 cases per 10,000 people, of people who are actively infectious, and then it dropped back down. We could look at Racine County, which is this one. I can hover on it, right? You see the same pattern, exponential growth and then very quick decline. The other big outbreak in Wisconsin, which you don't hear about as much about, is happened in Dodge County. And you see it's the same pattern, exponential growth, a little bit of wavering up here, and then it dropped quickly. Any questions about outbreaks before I go on to my next topic? Or actually, I'll look at a couple of national examples, but any questions on outbreaks at this point? All right, let me look at some national stuff. And we'll look at New York because that was the big one, right? New York's outbreak was different in kind than everybody else's. So we want to look at Northeast, Middle Atlantic region, and New York here, right? And we can see that the state of New York hit 127 cases per 10,000 people, which is a lot. If I filter down, why am I filtered on Washington County? That's odd. Oh, that's because I'm filtered on national places that have protests. So I'm gonna look again at New York. The other thing to say about outbreaks is the news has a habit of talking about states. And unfortunately, there's some inaccuracy there. So in Wisconsin, our counties have been all over the map. At the moment that Brown County was having the worst outbreak our state has ever had, the entire rest of the state was relatively flat. When New York City was having its major outbreak, you can see here, New York had a crazy outbreak. They got up to 800 cases per 10,000 people, right? But the other counties in New York were less. Like Nassau was also having an outbreak, but not nearly like New York City. Dutchess County was having an outbreak, but the rest of the counties, were down in the normal range, right? So you could talk about New York State because so many people live in New York City. And even if you average everything out across the state was still having a major outbreak, but that outbreak was in New York City. If you look at Arizona right now or at Florida, it's a relatively small number of counties that are having really crazy outbreaks, and the rest of the state is kind of, in some average, upper average range. And so when you hear people talk about states having outbreaks, that's a little bit of a misnomer. It's really, there's certain counties and certain geographic regions. COVID doesn't really care about geographic boundaries, right? They don't care where state borderlines are or who's governor or whatever. It's very like regional and county based. So that's what I've seen in terms of the data. And I'll show you the same trend that we just looked at in Arizona right now. Actually, they're in the West. So we can see Arizona here, right? And Arizona has a big outbreak right now if you think of a state as having an outbreak. But then you look at all the counties, right? And you see some of these counties are having very high numbers, right? Like you look at Navajo County and Apache County, or in the upwards of 100 range, 100 people to 10,000. And then you look down here and you see that Maricopa County is at 146, Navajo's at 136. Some of the other ones are still pretty high, but these lists that you see here is generally the highest ones. There's still a lot down here that are in pretty low ranges, like 5 to 10. So yeah, which is actually good news, that like if you have an outbreak in a state, that doesn't mean that it expands to the whole state right away and every county is experiencing the same amount of infection. And that's been really good news for Dane County, because like the outbreak in Brown County had very little effect on Dane County that we're aware of. Outbreaks we've seen in Racine and Milwaukee have had very little effect in Dane County. The fact that we're an urban area that's surrounded by 90 miles of relatively rural area, I think has served us well for the most part. The outbreak we've had seems to have been homegrown as far as I've been able to tell. Okay, questions and outbreaks before I start talking about age. I'll give you 30 seconds or so.
Any questions for Jeremiah? We'll certainly have time for questions at the end as well. Perfect.
I'm going to look at age in Wisconsin. And there are trends by gender, race, and other things, but age is by far the strongest trend. So here's the two charts. This one up here is the percentage of positive tests by each day from each age group in the state of Wisconsin, right? So, right, we see very few younger kids testing positive, and that is probably because very few younger kids, and there's been essentially no deaths. Like worldwide, there have been, like, you could count the deaths of people who are under 10 years old on like 2 hands. There have been very few. And so younger kids just don't experience a lot of symptoms. Thankfully, they tend to be smaller and they tend not to be as infectious, which is good. But you can see early on, a large percentage of the cases were with the older generation, right? So 20% of people who were testing positive were 60 to 69, 10% were 70 to 79, 5% were in their 80s. But as we've gone along, and this is a good thing, a lower percentage of the cases have been testing positive amongst older people, right? So 60 to 69 is now below 10%. People in their 70s is now below 5%. People in their 80s is below 3%. This is a real success story, actually. In New York State and other places, there have been large numbers of infections in nursing homes where lots of people have died. Wisconsin has done a pretty good job of protecting our nursing homes. And I think that's a testament to the nursing home organizations, to the managed care organizations, to the, to the policies that everybody's put in place. We've done a relatively good job of protecting nursing homes in Wisconsin. When you look at death rates by positive tests, right? So these are all the people who tested positive, and then we have the percentage of people who died. So people in their 90s, about 32% of people in their 90s who tested positive and ended up dying. And I have another chart that shows why nobody's talking about ventilators anymore. So the rate of people going to the ICU and the rate of people dying are pretty similar. So like for a while, we had a large number of people that were being sent to the ICU, and the death rate was pretty close to that number. And then at this point, the death rate is almost identical to the number of people that are being sent to the ICU, which basically implies that if you get sick enough that you need a ventilator, you don't have a very strong chance of survival. And so ventilators, which basically means ventilators don't help as much as we initially thought they might. There's been a lot of articles about like how just getting people to lay on their sides is just effective as a ventilator, because if you get it on a ventilator, you're sick enough that you're not likely to make it through, and having a ventilator hooked up to you adds lots of additional risks, like you need to have an IV and lots of other kinds of things, which are also risks. So a high percentage of people in their 90s who get it pass away, 30% or more. In their 80s, it's 20%. In your 70s, it's 14% if you get sick and you're in your 70s and you test positive. There's a 14% chance of death, and it drops off really fast. So people in their 60s, it's about 5%. People in their 50s, it's about 1.7%, and then it drops below 1%. So anybody under 50 years old, your odds of dying from COVID, if you get it, are dramatically lower than if you're older. So age is the primary factor in risk. Now, there's also things like heart disease and diabetes. Wisconsin's not tracking that information, so I can't say how strong of an effect that is. Any questions on age? The obvious question that comes to my mind when we talk about age is, okay, here, thanks for your great presentation. Young people are being infected. Should be concerned that young people are being infected at a higher rate now, presumably because going to bars, that they will infect older people because the young people work in restaurants and nursing homes, and that will inevitably see that results if we go into the fall. So I can't predict what's going to happen, but I can clarify a couple of things based on my reading and looking at the data. So yes, a lot of younger people have been infected recently in Dane County. There is, in my opinion, the biggest sort of failing of the public health communication right now is not doing a great job of communicating why that's a bad thing. So when you think about the disease, and this has probably occurred to every single one of us, you would think that lots of young people getting infected, as long as they stay to themselves and don't infect older people, that would be a good thing, because over time, then you have a lot of people who have some level of immunity, which protects the whole population. The virus can't transmit as easily because it gets to a lot of people who just don't get it. So the thing that I think that public health folks haven't done a great job of communicating is that is extremely painful. So for that to really work, where enough young people get sick that it protects the whole population, would take probably years, and our hospitals would be full for a long time during that. And so that would be an extremely painful process, and it's also far from guaranteed. There's a lot of research that immunity, especially immunity amongst young people who don't get severe symptoms, may not last especially long. It might be in the range of a few months to less than a year. And so there's a lot of risks around that approach. It's also not guaranteed. At the same time, the research around vaccines seems to be going pretty well. And so if we get a vaccine, we will probably get that vaccine long before the possibility of lots of young people getting infected and being able to protect society because of that happens. So vaccine is probably going to happen first, and the odds that it's going to work are probably higher than the odds that what's called herd immunity would really work. So whether lots of young people getting sick are going to infect the older people depends entirely on what those young people do and what the older people do. So right now is a great time, if you have grandkids, to not visit them. Right now in Dane County, keeping older people and younger people separate is a really good thing if we can do it. Especially younger people who live in the areas where there's been a lot of transmission, like downtown has been a lot, but there've been some other areas too. And yeah, obviously younger people can infect older people. That can definitely happen. The one thing that is hopeful that I shared earlier is that outbreaks tend to be spikes. They tend to go up and then tend to come down. So if you want to visit your grandkids, you won't have to wait forever. The risk will come down again.
So there's another question here, Jeremiah, which I can ask you while you're thinking about it from Ann, our chair. Do you feel like we have more access to data than ever, or that we are missing key data points that will help us make better decisions, or both? What key data have you hoped would be released that hasn't been collected or released? Many businesses are afraid of having cases amongst their employees disclosed, but I also see why that's helpful in controlling this.
Yep, you got it. That's the kind of data I'd be really interested in. Which businesses have had lots of cases, which zip codes have had lots of cases. We're sharing data by county, but data by zip code is really spotty. And the contact tracers, right? So what are the patterns? You know, like we've just started to get some good data out of the county and out of the city around what's happening with the contact tracers. What are they learning? But that data is not put in charts yet. So it's not being released as data sets. I'd really like some good quality data from the local area based on what the contact tracers are finding. I could see why they wouldn't be prioritizing that. They want to spend all their, I mean, if I was them, I would want to be spending all my resources on getting the data, like interviewing as many people as I can, and then getting that data to the people who are making decisions. Now, that's frustrating to me because I can't get the data, but that seems logical why they do that. Bars and restaurants were mentioned. I should say that in the results of the contact tracers, bars and restaurants are mentioned, and there's a lot of new regulations on bars and restaurants because that's something that the city has some control over for the county. The majority of transmissions is actually not bars and restaurants. It's people getting together in individual homes, right? Which is much more difficult to regulate. So if you have a bar or a restaurant and you're really itching to be able to reopen a little bit more, it would behoove you to encourage people to really try to be careful when they're having parties and getting together in homes, because the more people do that, the more the infection rates move up and the less freedom bars and restaurants are going to have. So what people are doing by visiting other families and having parties and stuff like that is really affecting everybody. And the more people, behave or comply in that sphere of lives, it will make everything better for everybody else.
Perfect. I think that's all the questions we have for now. But please keep sending your. We do another question just came in. Sorry. Contact tracers. Is there enough progress being made in tracing technology and practices?
I don't know the answer to that question.
Well, we will ask that. Actually, we can ask that question of public health. I think there's a lunch today that the chamber is running at noon. So I highly advise people attend that as well. So I think that's all our questions for now, but certainly keep sending the questions in through the chat, and then Jeremiah will stop intermittently for more questions.
All right, let's look at the national picture for just a second. So I'm going to look at legislation and regulation, and I'm also going to look at just general trends. And so if we look at the regions of the country and we see the number of people who are actively infectious, everybody knows about what happened in New York and New Jersey, right? The Midwest, the South, and the West have, been in moderate amounts of cases. The Midwest was doing worse for a while, driven by Michigan and Illinois, and then eventually Iowa and Kansas. And then things kind of converged at this point here. And this was really fascinating, where essentially all the regions and most of the states had a similar number of cases, which was really interesting that we all converged. And then things unconverged or deconverged. And the trend that you see right here is pretty clear. The South and the West has had a dramatic increase in the number of cases, right? We're experiencing it right now in Dane County, but Dane County is experiencing something that the rest of the state isn't. There's a few counties around us that are also experiencing outbreaks, but The state as a whole isn't necessarily. And so the thing that the South and the West have in common is that whereas the winter here is the time when we're indoors, in the South and the West, now is the time when they're indoors, right? And you know, the big protests that we had in Madison and other places, and if we have time, I can pull up the counties where that happened. That was a fantastic experiment. Probably wasn't the ideal way to do that experiment, but it was a fantastic experiment of getting lots and lots of people together outdoors where people aren't standing next to the same person the whole time, right? So people are moving around, they're marching, they're standing next to somebody, and then that person moves forward, then they're standing next to somebody else. I have not been able to see any measurable impact that the protests in any of the cities that I looked at have had on COVID transmission. So outdoors is fantastic, especially if you're not staying in one spot and you're moving around and you're next to different people. So if you're having a conversation with somebody and you're looking at each other and you're 3 feet away and you're just talking to each other outdoors, unless it's really windy, there's still a risk there. But if you're talking to one person, then you're talking to another person, and you're switching who you're talking to every minute or more, your risk is much lower than if you're doing the same thing indoors. So we look within these areas, like actually the South is all pretty hot. But if we look at the West, and we look at the states in the West, we can see that there is a trend where the states that are the hottest, which have this tendency to be indoors in the winter or in the summer, are experiencing the biggest outbreaks. So Arizona, 123 cases per 10,000. And remember that Arizona isn't experiencing a uniform outbreak. It's a small number of counties in Arizona that are experiencing a really bad outbreak. And then we look at Nevada, 62 cases per 10,000 across the state. New Mexico is a little bit lower because New Mexico is more rural. And then you have Idaho that's a little bit high. In California, you know, people think of the ocean, but California is a big state, and a lot of California is really hot right now. And the counties that are really hot are the ones that tend to be experiencing the biggest outbreaks. So this question of how hot it is and how much time people are spending indoors is a really big factor right now, which means that the decision that the city is trying to make and the county is trying to make around trying to encourage people to have things outdoors, right? Closing down State Street from any traffic so restaurants can have more people outdoors is a good idea. Outdoors is really, really the place to be. Which gets us to what do you do if it gets to be fall and outdoors? Like, what can we learn from this lesson about outdoors that is, you know, that what lessons can we learn? And I will share something in the chat, which is a paper that the American Society of Refrigeration and Air Conditioning Engineers put out. And it's a long paper, but I'm just going to paste in the recommendations for businesses for buildings. So here's recommendations for non-healthcare buildings around ventilation, right? Which basically, to the extent that you can do anything as a building owner about COVID, the thing that you can do is to make your building as much like the outdoors as possible, right? So move air, get lots of air moving through the space, move outdoor air, get MERV 13 filters so that you can filter the air so it's pure, so all the COVID is taken out of it and you're circling it back through, and install UV filters that can kill the COVID as it passes through. So these are the ASHRAE recommendations, and they're sort of the body that's the most expert in this kind of stuff, and they're working with doctors. And so in terms of interior spaces, if you want people coming back, moving air and cleaning that air is probably the most effective thing that you can do, besides social distancing and masks. That's also important. And it's worth noting that, like, you can have people in separate offices and you can have people social distancing, but if you have air that's not being cleaned or air is being recirculated and it's not fresh air coming in from outside, you know, COVID can go through the ducts. And if you have somebody who's near a duct that like sucks air back into the system, and then somebody else is near a duct that comes out, you know, it can go through the duct system and you can infect somebody on the other side of the building if the airflow just happens to do that. So they have some pretty specific recommendations on how to make improvements to that kind of stuff. And if you're interested in opening up, I'd highly encourage you to read those and think about them. My past life was as an energy efficiency engineer, so I kind of crossed a couple of different things. Okay. So we talked about ventilation in buildings. Let's talk about deaths. Oh, and I did want to talk about reopening, because I said I was going to talk a little bit about legislation. So here's a chart, once it opens for me, that shows all the states. And it takes a second to load because there's a lot of data going into this. So this is not up to date super recently. This is, so this charts the trends in each state throughout the country. Actually, the lower 48 states. Alaska and Hawaii are doing very well for obvious reasons. The lower 48 states, actually islands are great right now. New Zealand, to my understanding, has not had a single case in like 3 months. So this is the lower 48 states, and it's color coded. So the light blue states are states that never had any closed down regulations. The states that have different colors, the orange is before they had any shutdown regulations. The purple is during shutdown, and the dark blue is after shutdown. Now, this hasn't been updated. This data came from the New York Times, and it took a while to clean. And so I haven't updated this since mid-May. And so if a state was shut down at mid-May and then opened up in June, I don't have that marked. We can probably assume that most of them did. Like Pennsylvania was shut down in mid-May and then did eventually open up sometime around here, but I don't know when it was. So we can see that there's a lot of states that are having outbreaks right now, to the extent that states have outbreaks, which you talked about. So Utah's having big growth in cases, Vermont is having good growth in cases, Oregon, Pennsylvania, where else am I looking? Arkansas, California, Arizona up here, Alabama, Georgia, right? So we're looking at a lot of states that are hot. Idaho's having a big outbreak right now. We look down here, there's Florida, Louisiana, Montana, Tennessee, Wyoming. And then Wisconsin is having a moderate outbreak right now. So Dane County is the biggest part of that. Right now we have more cases per 10,000 than any other county in the state. And so, like, if you look at this whole chart, you could see sort of a little bit of a pattern that reopening had some effect on growth. But that pattern is pretty spotty. Like, we look at Ohio, and they had an amount of reopening, and that seemed like cases went down, and then cases went up, right? And I don't know enough about Ohio to know if something happened here. But I see Utah also had a reopening, cases were flat, and then cases went up. Georgia had a reopening, cases stayed flat, and then cases went up just recently. Alabama, similar. They actually had an unusual trend. It is like slow growth is actually pretty unusual. Spikes are more common. And so, you know, the news has talked a lot about how states have had reopening rules and how that's like the way that the story gets told is that led to a major spike in cases. There's a lot of examples of where that didn't happen. So Pennsylvania had a reopening and then things went way downhill. Virginia had a reopening and things have stayed flat. Like, you can come up with counter examples of states that have reopened that have remained flat. Now, there's a lot of details in here, and it could entirely be that the devil's in the details. The best conclusion that I can draw from this, which I wouldn't put a lot of money on, but you know, I'd like to have some kind of conclusion that I can make, is that people's individual decisions, right? How people think about the disease, how people behave, whether people wear masks, whether people are going to visit each other, whether people are doing things indoors and outdoors, whether people are upgrading their HVAC systems, all this stuff, individual decisions that nobody really has the ability to regulate, right? Cops aren't going to stop by your house and look to see whether you have guests. It's impractical to regulate that stuff. That those individual decisions that everybody makes are a huge factor. And so, you know, there could be an extent to which regulation is having a significant factor too. I can see a little bit of that in some of this data, but the result of regulation is not extremely obvious. Like, you kind of have to make some inferences to be able to see that. So that's disappointing. Actually, it'd be nice if we could believe that, you know, regulation would make all the difference in all this stuff. And there probably are kinds of regulation looking at other countries that would really help, like major investment in nationwide contact tracing and all that kind of stuff. But in terms of like state opening and closing regulations, I'm not seeing the obvious trends that would be nice if we saw. Any questions about that? I see a question from Bill.
Yeah, 2 questions in the chat right now. What are the factors that change to cause exponential growth in new cases to reverse? Is it that the public realizes there is a big problem and starts decreasing their risky behavior?
That would be my guess as well.
Okay.
It's I haven't seen any data that implies that that's in any way measurable. But that would be my guess as well, is that people see the news and they're like, holy crap, Madison's exploding, and people are careful for a while, and then things go back down. I think there's also a very large element of luck, right? Because you have people who are just not gonna behave. They're gonna go get together with large groups of people because they're extremely social and they're just not interested in following rules for whatever reason. If that person happens to go to 5 weddings and they have COVID, then you have an outbreak. So it's amazing the extent to which individual behavior can make a huge effect. So, I mean, we're living in a time where individuals can have, individuals who aren't interested in behaving can have a large negative effect on other people, and that's really unfortunate, but it appears to be reality.
So actually a follow-on question on that is a couple questions about the effectiveness of masks in preventing the spread. Any data on that and what you're seeing in trends?
I don't have any data on that. There's a lot of data coming out of like the epidemiological community that implies that it is pretty effective. About like, it doesn't do much for you, right? If you wear a mask, it isn't going to do that much for you, but it's going to protect other people. And so, yeah, the data on that, to my understanding, is relatively clear. It also protects you from like putting your finger in your mouth, right? So if somebody coughs on you and you get COVID on your fingers, you're not going to put your finger in your mouth because you have a mask on. So to my understanding, that data is pretty clear. There's not like, there haven't been any major studies where people have monitored like stores to see how many people are coming in with masks and then like tracking who goes to those stores. It's just impractical to study that. And there haven't been enough states that have said people need to wear masks everywhere they go for long enough yet that we can tell the results of that yet. So the data is just not really there. And I haven't looked at international data, but there might be some international data on that.
Well, that's a follow-up question from Anne about, do you have data on states that have done large marketing campaigns on masks? Probably not yet, because it seems to only be the last few weeks or so.
I don't have data on that.
Perfect. And then we've got one other quick question about the HVAC suggestions. People would love to hear more about that, but I can work with you offline and get that to the committee as well. So
let's see. I think I can get you the source for that information pretty quickly.
Perfect. Perfect. And I can send that to all of our committee members as well. So we can absolutely follow up on any questions that people have working directly. So I think I'm all set with questions for now, unless anyone else has it.
I'm going to type the name of that document in here and you can Google it really easily.
Perfect.
Or,
thank you. Oh, got it.
Or DuckDuckGo it if you're concerned about privacy.
I don't even know what that is. I'm from Minnesota. I think it's called Duck Duck Grey Duck. But gotta have some humor when we're talking about COVID, right? Perfect. We'll send that out. So we're all set with questions for now.
All right, let's look at death real quick. And please keep the questions coming. Those are obviously more interesting than me talking. So we'll look at Wisconsin first. So deaths are generally down nationally, and they're also down in Wisconsin. And so far, the outbreaks that I've seen haven't had a big effect on deaths. The question earlier was whether younger people are going to go work at nursing homes and work at stores and visit their relatives and get them sick. And then those are going to result in deaths. So there's obviously a time delay on that, right? Because young people get sick and then they take a little while before they're infectious. And then they go to work and they might get somebody else sick. And that person is going to take a while before they get sick enough that they might die. So there's at least probably a 3-week delay on that. And the big outbreaks have just started to get to the point where they're like 3 weeks old. And so if it is going to have a big effect on death, we should know pretty soon. Unfortunately, the timeliness of this presentation doesn't allow for that. I will give you a link where I'm posting my data, and you can look at it whenever you want to. I'm not updating it every day. I'm updating it weekly or so. So if we look, this is actually cases versus deaths. So it's cases that are active per 10,000 people compared to people who have died in the last 2 weeks. And so statewide, the cases per 10,000 people have been creeping up, and this has been driven by Dane County, La Crosse, and a couple of other places right now. At the same time, deaths have been going down. If we look at our region of Wisconsin, South Central Wisconsin, deaths or cases have climbed greatly, and this is mostly Madison because we're the biggest county in our region. At the same time, Madison has not had a death recently, and there have been a small number of deaths in our region. So far, we don't have that time delay yet, but we haven't seen it here. If we look at the Northeast and we look at the big spike in Brown County, which I think I need to apply filter. For some reason, this visual isn't loading. Let's see, state, population, county. So we can look at Brown County and we see what I just described, right? We see the big spike in cases, and then shortly after we see a spike in deaths. Now, in Brown County, that spike in cases was not primarily around young people, right? It was people who worked at meatpacking plants, which is a whole variety of ages, although not people in their 80s. So, you know, we have some evidence that past outbreaks will eventually result in an increase in deaths. I'll be watching over the next week to see, actually, I won't be watching, I'll be on vacation. But once I get back from vacation, I'll be watching to see what happens in Dane County. But I'm presuming it'll hit the news if there is a corresponding spike in deaths. The fact that so many young people have gotten sick and it hasn't been older people means there's hopefully some hope that it won't. We'll see. If we look nationally, I don't think I have a national number of deaths, but I do. Yeah, here we go. So here's deaths per 1 million people nationally. Here's regions, right? So we can see New York had a big spike. And there's some anomaly that happened in the Northeast. I think that they just reported things differently or something. There was a massive spike in deaths over the course of one day that occurred in like about 6 counties in the Northeast, which I don't know. I think it was somebody found a list and they finally started to report it. I don't know what it was. But you can see generally nationwide, deaths were at their highest, you know, in April. And they've declined on a relatively consistent way. If you look at states, you can see states have kind of been all over the place. Connecticut had a relatively high number of deaths per million people back in April. And then all of the states have been declining. And this is an anomaly of data, Delaware and a few other places. If you look at our region, Midwest, and we look at our proportionate, so the 2 regions in the Midwest, the East and the Western Midwest, you know, deaths were at their highest in April and May, it looks like, and they've been declining. Look at East North Central, which is our region, and you can see Michigan had the highest number of deaths ever of any, and there you know, was possibly some other reporting thing in Michigan here where they just reported a lot of deaths on one day. I don't know why that is, but, and then there was some another day when they somehow dropped dramatically. I think reporting on deaths might be delayed sometimes for some reason. I don't know enough about that. But right now, the number of deaths per million people over the past 2 weeks is, in Wisconsin, it's 9. So 9 people have died per million Wisconsin residents over the past 2 weeks. And we compare that to some of the other states where more people have died. But that's a big decline from April and May when it was, you know, in places over 100. So that's the deaths. And there's one more visual I want to show. Before I get to that, is there any other questions on deaths? Or anything else that I've talked about?
We do not have anything in the queue, but anything from the audience? Doesn't seem like. Thank you.
The last visual is kind of a fun visual. You've probably seen visuals like this before around things like historical economic growth worldwide. Let's see, where do I have it? So this is Wisconsin counties. And this is a visual called a bubble race. So these are all the counties in Wisconsin. The horizontal line are the total number of cases that that county has had as of yesterday, because we don't have data for today yet. The vertical line is the number of cases who are actively infectious, assuming that my assumption about the number of people who are actively infectious is accurate. It's the last 12 days. The color is the region of Wisconsin. So purple is southeastern, orange is our region, south central. Purple is north, or is west. The northern region is blue, and then northeastern Wisconsin is, let's see, which one is northeast? I think it'll become apparent when Brown County, oh, Brown County is Yeah, there's some kind of color code problem. Brown County should be a different color than Wisconsin, but somehow they ended up being the same color. There's a question right now. Do you trust the information from government sources that could skew data to further agendas? What I've seen and heard is that I haven't heard or seen any evidence that people are intentionally releasing data to further agendas. I don't know if this is coming as a result of those anomalies in the death rate, why it spikes really quickly and then drops really quickly. That seems really odd to me because it's specific counties that are doing that, and they're counties in different regions, which I don't know why they would be doing that. What I have heard about the data is that some places are better at collecting it than others. So Georgia was one of the first states that had reopening, and as we saw, they had that reopening didn't seem to have much effect for a while, and then they had a quick growth. So Georgia was sort of heavily criticized during that time period for being pretty spotty in their data collection, and their data analytics team was pretty small and not very well organized. And so the quality of the data that they were collecting and the extensiveness of it wasn't extremely thorough. And so I expect that's happening other places where the departments that organize this data are small and don't have enough budget to really do a great job of getting the data together. I haven't even heard any accusations that there's anybody who's intentionally manipulating data to give false information. So I don't know. My take on government information is that, like, when something weird is happening, somebody's going to leak it. I tend not to believe conspiracy theories because I've had enough experience, or at least government conspiracy theories, because I've had enough government contact to. I just don't believe that people keep secrets. Like, if something weird happens, somebody's going to leak it. I haven't seen that government has enough ability to keep secrets that if something weird's happening, it's not going to get out. And I haven't heard anything getting out about people intentionally manipulating data. I'm not sure exactly what your question was about, Tom, but that's what it made me think of. Did that answer your question? Yes. Okay. Thanks.
He said yes. Sorry, in the chat. Perfect. We've got 3 minutes left here, Jeremiah.
All right. I'm gonna hit play, and then that'll do it. So we can see the start. So this is March, and we see Dane County had the first test positive in Wisconsin, and you can see the growth of cases. The size of the bubbles are the number of people that live in that county. And so Milwaukee quickly overtook Dane County and the other counties in terms of how many people were sick and the percentage of people that were sick. We can see Waukesha is shortly behind Dane County, and then we're going to quickly see Dane County get things under control. And that could be luck. It could be the fact that we're surrounded by farm fields. It could be any number of things. We see Kenosha and the southeastern part of the state has generally, increased, and there's a lot of reasons. You can see Brown County is having its biggest outbreak that anywhere in the state has had. Which, to the extent we know what happened, it was around meatpacking plants and other manufacturing. And then you can see Dane County's got things very much under control for a long time. And the southeastern part of the state is, continuing to have relatively high numbers. Brown County is getting its outbreak under control, and you can see it's dropping down. Rock County is having an outbreak right now, which didn't get a lot of press, but it was a pretty significant one. Rock County is not quite as populous as Brown or Dane or Milwaukee counties, and so didn't get a lot of attention. Then Racine County had one, and then Dodge County had one, and Forest, Wisconsin, in the northern part of the state had a relatively significant outbreak for a while. The rural parts of states have generally had lower numbers of cases, but when enough people get sick in rural parts of the state, they can also have an outbreak. La Crosse is having one right now, or had one a little while ago, and we're going to see Dane County's outbreak begin to grow here, so we become the county in the state that has the highest number of cases right now. So that's it. That's my presentation. I'll put my contact information in here. You're welcome to reach out. And yeah, I'm available for consulting opportunities to, reducing the amount of uncertainty so you can make decisions is sort of my life's work. And so if you have other situations where you need that, I really enjoy it.
Awesome. Thank you so much, Jeremiah. A very insightful presentation on a very important topic to us right now. So thank you very much for the presentation. We are going to send out the extra information in that website that you mentioned in his contact information. We'll send that out to the entire committee so everyone has access. I'll connect with Jeremiah later today for that. Again, please join us on a positive note after we've had all that sort of tough information. Tonight at 4 o'clock, we have our virtual New Faces, New Places at, well, virtually, but with the Classroom Canteen on master margarita making. Hope you can join us for that. And then a week from today, we're going to meet again as a committee, Economic Development, with Jesus Villa from the Department of Workforce Development. Hope you can join us in 1 week's time. Thank you again for all joining us, and thank you to Jeremiah for the wonderful presentation. We really do appreciate it. Hope you all have a great rest of the day, and hopefully we'll see you later this afternoon. Talk to you soon.